the health in our prayers, and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic disease has reached crisis proportions in our country. And finally, we have an administration that is taking action. The MAHA report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the MAHA report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food dyes, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
The committee will come to order. I apologize to you for that outburst, Secretary Kennedy. I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We're ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss of 476,000 unaccompanied children. We have implemented policies now to ensure that that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the President's Big Beautiful Bill, which will provide the greatest investment of federal money into rural health care in history. Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years.
Thank you very much, Mr. Secretary. I'll begin with the questioning. And one of the first things I'd like to talk to you about is actually something that is under the auspices of CMS. And I spoke with Dr. Oz last night about this. I'm sure you're very familiar with it, though. And that is that in the One Big Beautiful Bill, there's a lot of attacks right now going on publicly about hospitals are in trouble. And the blame for that is placed on the bill, even though the bill hasn't even been implemented yet. The fact is, this committee held hearings on the troubles that rural hospitals are facing in the United States before the passage of the One Big Beautiful Bill. They've been facing difficulties in rural America for a number of years now. And the bill, the One Big Beautiful Bill, contained a rural health transformation program, which I would just like to ask you to comment on. This is the program which allocated $50 billion over the next 5 years to our rural community hospitals in the United States to help them deal with some of the financial crises that they are facing and transition to more stability. Could you comment on that program that is in the One Big Beautiful Bill?
Yeah, Senator, one of President Trump's campaign promises and one of the principal preoccupations, not only of Republican senators when I did my confirmation hearing, but also almost equally among Democratic senators, with crisis in rural health. We've had 120 rural hospitals close over the past 10 years. These institutions are not just delivering health access to rural Americans, but they are economic centers, they are cultural centers for those communities. They are often the largest employer. They are the highest paying jobs, and they are the centerpiece for those communities. So when they die, the communities collapse. And President Trump promised to do something about that, and he has delivered on that promise. Right now, we spend about 6% of Medicaid funding is sent to rural hospitals, a very, very tiny slice, and that's one of the reasons they're in trouble. President Trump has now allocated through the One Big Beautiful Bill $50 billion, so $10 billion a year over the next 5 years. What we give to rural hospitals, that 6% represents $19 billion a year. So we're increasing that by $10 billion. So we're infusing more than 50% increase in the amount of money that is going to rural communities over the next 5 years. There's never been anything like that in history. It is the biggest investment, and it should stem this hemorrhage.
Well, thank you. I appreciate your giving clarity to that, because it is frustrating to see these continuous allegations that the difficulties that our rural hospitals are facing all were created in the last few months when we passed a bill, when we've been holding hearings in this committee about these problems. And in the bill that we passed, we gave a $50 billion boost to, as you indicated, increase by 50% the federal support for our community rural hospitals in the United States. And I think that the hospital owners understand that. They recognize this support. In fact, they are coming they're coming together very carefully with Dr. Oz to work on the rollout of this program so that we can see this boost and this support that is coming. Just another one of the disagreements we have about what really was in the One Big Beautiful Bill. So I appreciate you commenting on that. In the last minute and 10 seconds that I have with you, could you just quickly talk once again about the broad issue of making America healthy again in terms of our aim to change the healthcare system's focus from a reactive symptom management model to one that focuses on lifestyle choices and the root causes of chronic disease?
Yes, Senator, this morning I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent zero on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause. It's increasing. And all of the arguments that Republicans and Democrats have about single payer, Obamacare, or the various ways to allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
And
Mr.
I need to fire some of those people to make sure this doesn't happen again.
Thank you, Mr. Secretary. I have to cut myself off to make sure I keep to this time frame too. Senator White.
Thank you very much, Mr. Chairman. I've made it clear. I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." So this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So my first question, Mr. Secretary, is, did you in fact do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations, even if she didn't think such recommendations aligned with scientific evidence?
No, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay. Let's talk now about what's coming up, because I've made it clear what I've thought about the 203 days with my colleague, Senator Also Brooks. In 2 weeks, CDC's Advisory Committee on Immunization Practices will meet to make decisions about critical vaccines that protect us against hepatitis B, measles, and more. The committee's got a profound impact on vaccine access, but these aren't ordinary meetings. You stack the deck to ensure the panel bends to your views. In June, you fired all 17 committee members who were respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists. As a result, this critical advisory panel has lost scientific credibility. After years, colleagues, we spend so much time not looking at this as Democrats and Republicans, but as good science and scientific, credibility. And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get, their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ASIP. I depoliticized it. The Congress has been investigating ASIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Yeah, maybe you're listening to a selective group of people.
You get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that
Position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest and we depoliticized it and put great scientists on it from a very diverse group.
Let me close with
very pro-vaccine.
Let me close with this because, like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I get a reply? Or Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman, and this committee put together on a bipartisan basis.
All right, we're going to proceed. And I just want the rest of the members to know, I gave Senator Wyden as ranking member some leeway there, but we're going to stick to the 5 minutes. Senator Grassley.
First of all, thank you. I have asked HH secretaries in the past to fully utilize the Rural Community Hospital Demonstration Program under Medicare. The program has been underutilized. In May, the CMS filled the open slots. Thanks to your agency's work, there's been 10 more rural hospitals in the program. It's important that the federal government uses every tool possible to help rural hospitals, and thank you for making that possible. Now to my questions. Back in January, during your confirmation hearing, you told me that you agreed to leave farming regulations to the Department of Agriculture and EPA. Do you think that any comments you have made since your confirmation on topics dealing with agriculture are consistent with what you said in January, that USDA and EPA ought to be regulating farming, and that the Department of Health and Human Services should not seek to regulate farms, the tools they use, or the markets that they sell into?
Yes, Senator, we are working very, very closely with Brooke Rollins and with the agricultural community. We've met with over 140 farm interests over the past 3 months to incorporate them to make sure that the MAHA agenda is consistent with their agenda. We are producing the best food in America, that we're protecting our soils and our soil microbiome, and that we're protecting all kinds of farmers, including those who want to transition to regenerative agriculture. We're consulting every stakeholder in the farm community in everything that we do.
I just raised the question because farmers in my state have been concerned about some of the things you're saying.
Senator, I can't hear you.
I'm sorry. Some of the farmers in my state have been raising questions about some of the things that they think you said, whether it was out of context or not. I just thought I'd raise this question so that you would keep by what you told us back in January at your confirmation hearing. Now, Senator Durbin and I have a bipartisan bill that requires price disclosures on TV ads. Price transparency is important in drug advertisement. I know that President Trump, Vice President Vance, and you are all supportive of this effort. When can I expect action from this administration on requiring drug companies to publish the price of drugs in their TV ads? And just in case you would tell me that you don't think you have that authority, can you help Senator Durbin and I on our bill so that we can ensure that you have legal authority to require price disclosure?
Senator, I think it would be good for us to talk about this offline. We are working on this in our agency, and I'm happy to give you the details of what we're doing.
Okay. I got a question here on transplant. Senator Kennedy and I have been working, or Senator Wyden and I have been working on this. For nearly 2 decades, I've engaged in a bipartisan oversight of the organ transplant system. RISA has developed a tool to combat transplant line skipping. I hope that you can take steps to make sure that these steps are being taken by HHS and ERISA to curb transplant line skipping. On July the 2nd, Senator Wyden and I wrote you a letter highlighting cases of OPOs in Mississippi and Kentucky. In each of these cases, OPO allegedly tried to harvest organs from patients still showing signs of life. I expect you to take steps through these organizations to ensure that this doesn't happen again.
We have mounted a major investigation of misconduct, of illegal behavior, of organ harvesting, of living people, of line skipping, of favoritism, of all kinds of scandalous behavior inside the organ procurement organizations. We have already ended the contract, terminated the contract with the sole source provider. We are reorganizing the entire industry so that this can never happen again. I'm happy to go into the details with you if I had more time.
Thank you. Senator Cornyn.
Mr. Secretary, the United States spends approximately 18% of our GDP on healthcare, and yet by most accounts, we rank roughly 10th in the world in terms of a healthcare outcome. Our Democratic colleagues seem to think the more money you spend, you're necessarily going to improve those outcomes. But at the same time, we have the two major drivers of our national debt, Social Security and Medicare, while we spend more money on interest on the national debt than we do on defense of the nation, which is an unsustainable trajectory. What is it that you're doing to address the effectiveness and the outcomes of our healthcare expenditures as opposed to just throwing more money at the problem?
Yeah, I mean, throwing money at the problem does not work. We spend 2 to 3 times per capita what European nations spend on healthcare, and we have the worst health outcomes. We're 79th in health outcomes globally. Over the past 20 years, we've lost, or 30 years, we've lost 6 years to Europe in terms of longevity. So our lifespan was even with Europe's, now it's 6 years behind. As I said to, as I remarked to Chairman Wyden this morning, or Minority Leader Biden, today we got new data that showed that infant mortality has increased in this country in 2024 for the first time in 20 years. Diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC, but also we've already righted the ship at NIH, at FDA, at CMS. And we are going to end the chronic disease epidemic. We are devoting thousands of studies. We're going to devote to identifying the causes, and we're eliminating them. And we're already starting. We're not waiting for everything to come in. We are starting now. We're doing this with food dyes, with grass standards, with dietary guidelines. We're going to get better food and better health to the American public because it's chronic disease that is bankrupting us and destroying our national security.
It seems to me one of the biggest problems that we have in America today is the trustworthiness of the information that we actually receive from the news media and from any other source. And obviously, the easiest thing for our Democratic colleagues to do is to scare people because that is a powerful emotion, no matter what the facts may be. Do you believe COVID-19 was politicized?
Yeah, the whole process was politicized. Senator, I mean, we were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they'd prevent infection. It wasn't true. They knew it from the start. It wasn't true because that's what the animal studies and the clinical trials showed. We were told that there was science behind cloth masks. The CDC allowed the teachers union to write the order closing our schools, which hurt working people all over the country, and then pretend it was science-based. All of these issues, and then I can show you, like, for example, Chairman Wyden was talking about me politicizing ACIP. During COVID, probably the most famous scientist on ACIP was Martin Kulldorff from Harvard, the great world-renowned epidemiologist and vaccinologist. And he criticized the COVID booster mandates. They ejected him from COVID because he wasn't in the orthodoxy. The two biggest health officials at FDA during COVID, Dr. Gruber and Dr. Krause, criticized the Biden mandates, vaccine mandate. You know, President Biden said in August, I would never take that vaccine, the Trump vaccine. And he came in, he mandated it, and then he fired the two top health officials at FDA who said, hey, this thing has not been properly tested. So the whole process was politicized, and even today.
So let me, in 15 seconds, so I think you answered yes. It was
Yes.
politicized. And I have concerns that when you look at some of the conflicts of interest in peer-reviewed articles in professional journals, and when you point out that even some of the physician associations are conflicted because of the money they get from the pharmaceutical industry, are you committed to trying to make sure that we use the best science and separate and eliminate politics as much as possible?
That is what my job is. That's what my mission is. Eliminate the politics from science.
Senator Bennett.
Mr. Secretary, in June, you fired every member. Mr. Secretary, Mr. Secretary, may I have my time back, Mr. Chairman? Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the, as I said, Dr. Malone is one of the inventors of the mRNA
That's fine.
vaccine.
That's not
So he knows a lot more
that
about
statement,
it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it. It's not true. It wasn't true when he said it. It is not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
The obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
How about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So,
Well, it's a panel. You just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
you mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free
I know you said that before. I do too.
to make
But
their own
you're-
choices.
So will they be just as free after these?
I assume they will be.
I will hold you to that, Secretary Kennedy, because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will
all
you
the
make it
evidence-
in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You
Are you
described
saying,
people
Senator,
moving the
Senator,
Titanic.
are you
chairs on
saying
the
that a
Titanic
mRNA
with-
vaccine has never been associated with myocarditis or pericarditis in
I am
teenagers?
saying, I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire,
You're evading the question.
no, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked you a
Kennedy.
question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Senator Cassidy.
Thank you. I'll try and restore a little calm here. And I'm approaching this as a doctor, not as a senator. I am concerned about children's health, seniors' health, all of our health. And I applaud you for joining the president in a call for radical transparency. Thank you for that. I said yesterday, I believe it, that President Trump deserves a Nobel Prize for Operation Warp Speed. If he had been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars. We reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
That was a statement.
I did not say that.
Okay, then let me ask, because you also were lead
Senator,
attorney.
I just want to make clear, I
Okay,
did not say
We'll
that.
check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. But let me ask.
I'm happy to explain why.
I have 3 minutes and 30 seconds left.
All right.
It also surprises me because you've canceled, or HHS did, but apparently under your direction, $500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems just to cancel. It seems like an incredible waste of money. But it also seems like a commentary upon what the president was attempting, what the president did in Operation Warp Speed, which is to create a platform by which to create vaccines. So this just seems inconsistent that you would agree with me the president deserves tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this the speech that you don't want me to
No, I'm
answer?
asking a
Because I
question.
want to answer that question,
Please, please. I'm
if it's a
asking.
question.
But be tight, please.
First of all, the reason that Operation Warp Speed was genius is it did something nobody had ever been done. I don't think any president, but President Trump could do it. It got the vaccine to market that was perfectly matched to the virus at that time when it was badly needed, because there was low natural immunity and there were people getting very badly injured by COVID. And then, but it was also brought in therapeutics like hydroxychloroquine and ivermectin and protocols for treatments. And there were no mandates. And then
Okay, I have
President Biden
another
came in.
question, so please, about 50
That's when
seconds.
I began litigating against President Biden's mandates. Now,
I'm sorry, let me go on because
in
you've
terms of
covered
me
the mandates
canceling those
before.
contracts,
I have limited time, Mr. Secretary, I'm sorry. You've called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest. I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP and the Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board,
Senator,
excuse me,
you have the facts wrong in there.
excuse me, can I have my time back?
Yes.
Yeah. What I am concerned about is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers. Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science. If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay. But it's not a
So if the
financial.
bias is
It's not a
disclosed that they are
financial
expert
conflict.
witnesses.
It's not a
Okay,
financial
Let me
conflict
finish
of
up.
interest.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID. This is from Eric Erickson, good conservative out of Atlanta, Georgia, occasionally gives me hell. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Thank you, Mr. Chairman. Following up on that same line as Senator Cassidy, because that's exactly, I represent one of the most science-based states in the country. That is percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives? And you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. Do you say
I
yes?
said the
Yeah. You
president
say-
also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
You
are those.
You canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines. And you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that? Leaving us more vulnerable to some other country, keeping the advantage on having the best technology. So I'm telling you, I represent a state that's about technology. I have two other quick questions for you.
These questions or statements, because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the enhanced premium tax credits,
Yes.
the Democrats had two chances to make them permanent, and they didn't. And they didn't
We're
for
the
a
ones
reason.
we're the ones who delivered it. So I'm just
They
asking
didn't
yes
for a
or no,
reason.
do you want to do something about this? Yes. or
I
no?
want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump
Do you
wants
think
to do.
do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who
yesterday.
were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were
Do you think they were perpetrating a hoax yesterday?
perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public. That's the first you're hearing about it. What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
Thank you, Senator Warner.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when we met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there
So
was
I'll
so
take,
many perverse incentives. And these are
you don't know
model
the
studies.
answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months and you don't know the data about whether the vaccine saved
and that's the
lives?
problem, is that they didn't have the data. The data by the Biden administration absolutely dismal. It was
So
data
who is
chaos.
politicizing? You're saying the Biden administration politicize all the data. Go back to what Senator Cantwell just
They
said.
fired Dr.
Go to
Krause.
the Trump Surgeon General.
They fired Dr. Krause. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krause.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you've got to one. I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there was not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing healthcare policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice. And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple, so maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support.
You support. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare. So you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill because across America,
What about what?
hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Senator Langford.
Mr. Chairman, thank you. Secretary, good to see you again. As I traveled around Oklahoma during August, it was great to be able to be home. I had several folks that contacted me. We had some great meetings with some rural hospitals as well. They're looking forward to the $50 billion for the One Big Beautiful Bill that is targeting towards rural hospitals, starting with $10 billion next year. I know you're quickly getting all the instructions out on that. We know that's in process. It was good to be able to visit with them, to be able to talk about that. They're very pleased. Thanks for the work you're doing on that. I also met with some of our groups that do incredible medical research on this. I know the NIH grants were held for a while and being studied. Those have been released, and grateful to be able to see that because there's some amazing medical research is happening, including some longitudinal studies. They need those dollars released, so I appreciate y'all getting those released out there. I did hear from a lot of our folks, and I want to talk about one of these issues from a lot of our hospitals, they immediately raised the issue of Medicare Advantage plans and how they're withholding payments, they're delaying payments back to hospitals, and a problem that's been for rural hospitals. I know y'all are working on that as well. We want to work with you on that. But you and I have spoken on the second issue on that, and it's the pharmacy benefit managers. During the confirmation process, it was interesting when you and I met in my office, you said every single senator brought up PBMs to you. And you made the statement during the confirmation process, this is an area that President Trump wants to take on, is the pharmacy benefit managers. This is unfinished business in this committee, but I wanted to just know, what is HHS doing at this point on the PBM issue in particular to make sure we're not driving out rural pharmacies, and what we can do to be able to make sure that's fair?
I mean, it's a priority for the president. He talks to me about it, I would say at least once a week, sometimes at 11 o'clock at night. We've met with the PBMs, and we are in talks with them. We're also in MFN talks with the pharmaceutical companies, who are also very interested in reducing the cut and getting transparency among the PBMs. And the PBMs have committed to us to transparency, to some protocol that will guarantee transparency. And then the part of the MFN negotiations would include direct-to-consumer marketing, which would eliminate the middleman. So I think we're doing a lot on PBMs.
Okay, that'd be very helpful to be able to see. It'd be very helpful for consumers across the country on this. You and I spoke as well, and you've made public statements on this, and the FDA commissioners made public statements on the issue of reviewing the safety issues of mifepristone. Your comments early on were every drug needs to be treated the same, needs to look at the same, and not have political biases, and how things are actually examined. There were a lot of changes on the allocation of mifepristone for elective abortions under the Biden administration. It's now open to anyone without a prescription on it. You don't have to go through a doctor on it. There's all kinds of issues that are happening now on it. So the question was, you said that there would be a review on that just to be able to look at it, make sure we're following all safety protocols. Do you know a timing on that review?
I can't give you the exact timing. I talked to Marty McCary about it yesterday, and he said it is progressing apace. We're getting data in all the time, new data that we're reviewing. And we know that during the Biden administration, they actually twisted the data to bury one of the safety signals with a very high safety signal, around 11%. So we're going to make sure that that doesn't happen anymore. We're producing honest science and gold standard science on that. I'll keep you abreast of where we are.
Thank you. Just go where the science leads on that. During the Biden administration, the Title X regulation that requires Title X family planning programs recipients to physically and financially separate from abortion activities, their Title X activities, and eliminate them promoting or providing abortion with those funds. That was flipped from the original Trump rule that was done under the first presidency. During a confirmation, you had committed to go back and look at that again and to be able to see. My question is, do you know the timeline for agency action for when that rule on Title X and the separation payments rule will be either reviewed or will actually be reinstated to the original Trump rule under his first presidency?
I don't know if they're I just don't know the answer to your question, whether they're actually reviewing the rule right now. I can tell you that the NGOs that have that issue, that refuse to separate their payments streams and separate their operations, are not getting funded.
Okay, well, that was an issue under the law when it first came out, to be able to keep those things separate on it. So look forward to that. Thank you, Mr. Chairman.
Thank you. Senator Hassan.
Oh, thank you, Mr. Chairman, and good morning, Secretary Kennedy. Just before I ask a question, I did want to note, in response to the Secretary's statement that the Trump administration wants to lower the cost of health insurance, that across the country right now, the median increase from commercial insurers that we're seeing this fall is 18%, just as families are struggling to make ends meet. Now, I want to follow up on a line of questioning that Senator Cassidy began. Mr. Secretary, President Trump said that the COVID-19 vaccine produced by Operation Warp Speed was, and these are the president's words, a monumental national achievement. Although I have strongly opposed many of President Trump's actions, I agree with him that Operation Warp Speed in 2020 was a monumental achievement. Unfortunately, you are undermining one of the president's biggest achievements, which, as the president said, saved millions of American lives. You even went as far as to call President Trump weak for this life-saving accomplishment. Last year, you tweeted that President Trump has a weakness for swamp creatures and that Operation Warp Speed was among, here's your quote again, the most devastating impact of President Trump's weakness. So, Mr. Secretary, was Operation Warp Speed a monumental national achievement, as President Trump said?
For the reason that I already said, and I assume you won't let me repeat, but I'm happy to if you want, yes, it was.
Good. Assuming it is a monumental achievement, you've said it was, is it true that, as President Trump has said, he saved millions of American lives with the COVID-19 vaccine? Because you've just expressed great confusion about that to Senator Warner.
The only confusion I express is exactly how many lives were saved. I don't think anybody knows that because of the data chaos.
So multiple studies have shown that the vaccine reduced infections and severe diseases and saved at least 3 million lives in the United States and millions more abroad in the first 2 years of the pandemic.
It's possible those are modeling studies.
I will also note, just as you've been talking about data and concern about it, the process for COVID vaccine approval was public, it was live streamed, and it was out in the open. Manufacturers and experts have publicly submitted data analysis, and when the FDA has asked for more, they've submitted more. They've done that for years, and the evidence is clear and supports what President Trump has said. The vaccine works, and it has saved millions of lives. Your own process, on the other hand, has not been transparent. You repeatedly choose to ignore data because it doesn't match your preconceived notions and lies. So you have said that the vaccine did save lives. You've said it was a monumental achievement. And given that, if you agree with President Trump that the vaccine saved millions of lives, why have you acted behind closed doors to overrule scientists and limit the freedom of parents to choose the COVID vaccine for their children? Why have you done that?
For the COVID vaccine, I was removed by FDA because there was the industry.
No, it was behind closed doors.
No,
with
it's not behind.
And scientists who said they wanted to brief you on the science, scientists who wanted to understand why the FDA, why you unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label.
This is crazy talk. You're just making stuff up.
To prescribe a vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what?
Yeah, I do. I know exactly.
Do you know what an off-label prescription is?
I know exactly how it works. I know exactly how it works.
So why behind closed doors?
It's not behind closed doors. The industry makes the studies, and they could not provide a study that said that it is effective for healthy kids.
So when have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all public.
Now parents who decide that they do want their children to have
You're just
COVID
making
vaccine
stuff up, Senator.
I'm not
You're
making
just
stuff.
making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy. So let's just settle with this. So here's what's going to happen. To Senator Warner's point, to the parents who are concerned all around the country, to people who want to get the COVID vaccine this fall, even if they're under 65, because the boosters have worked, there's been much less serious disease. People do not have the same level of threat and risk from COVID that they used to because of these vaccines. People who want to exercise their freedom of choice are being denied that.
No, they aren't. Everybody can get the vaccine.
Because you are citing data that you won't produce to the public.
You're just
and you are rejecting
You're
science.
making things up to scare people, and it's a lie.
With respect, I do not think I'm the one making.
You are
Thank you, Mr.
lying
Chair.
right now, Senator.
Senator Barrasso.
Thanks, Mr. Chairman. Mr. Secretary, thanks for being with us today. I believe one of President Trump's greatest achievements was his bold and successful actions on COVID. When faced with a global pandemic, he didn't back down. He was determined to find a cure, and through Operation Warp Speed, a vaccine was developed that distributed quickly, safely, effectively, and I believe it saved many, many lives. I think it's a model of American ingenuity and public-private partnership. But this wasn't the first time an American president acted boldly to address disease and vaccines. There's a great book that's out, it's a prize-winning book called The Fate of the Day by Rick Atkinson, and he talks about the courageous efforts by George Washington. During the Revolutionary War, George Washington reversed his opposition to the smallpox vaccine, and he ordered that all the soldiers be vaccinated. It was among the most consequential decisions Washington would ever make. By protecting his troops from smallpox, Washington preserved the Continental Army, which allowed our nation to continue to fight for our independence. And like President Trump, I believe President Washington acted decisively to protect Americans' lives at a time of great national peril. So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership of the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on. You know, recent polls said 89% of voters, 81% of Trump voters agree vaccine recommendations should come from trained physicians, scientists, public health experts. So, they believe, Senator Marshall, Senator Cassidy, they believe me when it comes to vaccines. If we're going to make America healthy again, we can't allow public health to be undermined. So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
We're going to make it clear, evidence-based, and trustworthy for the first time in history. For most, right now, when I was a kid, I got 3 vaccines. I was fully compliant. Today's children have to get between 69 and 92 vaccines in order to be fully compliant between maternity and 18 years. Only one of those 19 vaccines, 92 doses, only one of those vaccines has ever been tested against an inert placebo. And what we're doing now is any new vaccine that before it's approved and licensed will have to demonstrate safety against an inert placebo. And we're going to go back and do observational studies on the existing vaccines to see if they're linked to any of these chronic disease epidemics so that people can understand the risk profile of those products and make good assessments for their own health.
So in 2 weeks, vaccine experts at the CDC are going to meet to discuss childhood vaccine recommendations. Parents and physicians depend upon this guidance to make decisions and to keep kids safe. And as I said, I support vaccines. I've been hearing from many of my medical colleagues, people I've known from medical school, residency, and when I practiced medicine in Wyoming, and there are real concerns that safe, proven vaccines like measles, like hepatitis B and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, that the public trust can be lost. So what safeguards are in place to ensure decisions are based solely on science and not politics? And how are you going to make sure doctors and parents can count on CDC guidance?
I mean, Senator, I would point this out. Right now, there's only 10% of children are complying with the CDC's recommendation on COVID boosters. Only 15% of healthcare workers. So Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true. That we're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we're researching and how we're doing it. We're going to be transparent. It's the only way to restore trust in the agency, by making it trustworthy.
Thank you. Finally, with chronic diseases like you, I'm committed to addressing our nation's growing rate of chronic diseases. I think if we're going to make America healthy again, We need to support rural primary care providers that play a role. As a rural physician, I want to make sure we can prevent and manage chronic diseases in their communities, and I ask for you to continue to work with us specifically with regard to rural health.
Thank you, Congressman.
Senator Daines.
Chairman Crapo, thank you. Secretary Kennedy, welcome. It's good to see you here again. I want to begin my time by talking about the issue of federal deregulation of chemical abortion drugs. Since mifepristone was approved in 2000, 25 years ago, the FDA has steadily stripped away that nearly 11% of women experienced a serious adverse event within 45 days of taking mifepristone. To put that in perspective, that is 22 times higher than the FDA's longstanding estimate of less than 0.5%. While these findings alone are shocking, my conversations with those in the medical profession, credible medical professionals, lead me to believe that even this study may indeed underrepresent the scale of the problem. For years, we've heard the misleading and frankly very harmful lie that's being sold to women that this drug is, and I quote, safe as Tylenol. These lies sadly have real-world consequences. Just last year, 2 women died as a result of taking chemical abortion pills because they were able to access them without appropriate medical oversight. And by the way, that's all allowed by the FDA. Mr. Secretary, I am grateful that you and FDA Commissioner McCary have already begun the process of reviewing this new data on the safety of mifepristone. We talked about this during your confirmation hearing. My question is, could you provide any update on the status and the scope of that review and whether the FDA intends to replicate studies like the one that I referenced?
I think those are, I don't know if they're going to do an insurance claim study. That's one way to do it. I don't know exactly whether they're doing epidemiological studies or observational studies. I don't know exactly what they're doing, but I know I talked to Marty McCary about it yesterday, and he said those studies are progressing and that they're ongoing. So I will keep your office informed at every stage.
Thank you. And I've had a really constructive conversation with the FDA Commissioner as well, McCary. And I mean, here's a very smart, data-focused, sincere type of leader. And we had a really good conversation. I want to encourage those conversations with you, Mr. Secretary, and that there's a follow-up here to make sure that the data that we now have exposed will be studied by the FDA and the appropriate actions considered. Given the legitimate safety concerns surrounding mifepristone and your actions to roll back other COVID emergency measures, will you repeal the COVID-era telemedicine allowance, given that we're repealing these COVID-era regulations and emergency measures? Would you repeal the COVID-era telemedicine allowance for chemical abortion drugs and restore the requirement for an in-person doctor visit?
Senator, I need to get back to you on that. I don't know if the White House has yet taken a position on that. We will get back to you this week about that.
Okay, all right. Thank you. I want to close with a quick Montana question. Earlier this week, the state of Montana submitted a Medicaid demonstration waiver application to CMS to strengthen the state's Medicaid expansion program. This waiver seeks to require community engagement and enhance cost sharing for working age, able-bodied adults enrolled in the program. I applaud our governor, Gianforte, and Director Brereton for their proactive leadership in this space. My question is, Mr. Secretary, could you commit that CMS will work quickly in its consideration of Montana's waiver application?
Absolutely. It sounds like the kind of waiver that we're looking for.
Okay, thank you, Mr. Secretary.
Thank you, Senator Johnson.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thank you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing in permanent subcommittee investigation on that hiding of the signal of myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data, and I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021, when I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because of all the censorship in the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. Again, I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high quality study. I'm not going to steal the thunder of Aaron Seary, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no, no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right? Is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta and Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that Black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
Letter I received from the Oshkosh business, it would be out of business because of the 50 employee mandate. It's going to be out of business. I just want to enter that in the record as well.
Without objection. The committee will take a 5-minute quick break here just to allow just a moment of reset here, and then we'll start right back up again in about 5 minutes.
And so somebody's going to be
Thank you to everyone. Committee is returning back from recess on this. Senator Whitehouse is recognized for questions.
Thank you, Chairman. Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program. Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential or that they see AHEAD as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my fourth round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put them in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and work out how we do this in Rhode Island. What is our patient base that we'll do this in? How we put the waivers together? To quote your CMS director, Mr. Oz, he said, as we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good. So
Senator,
I
everything
need
you
you to respond to me. You guys know where to find me. I'm up in the Hart Building.
Yeah.
We've reached out, we've tried for meetings, and the progress in all 3 of those areas, fixing the payment gap, getting ahead balanced regionally, and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy.
I'd like it to end and get some progress.
Yeah, Senator, you raised this during my confirmation hearing. And I said to you then, and you were very civil. You raised something that makes a lot of sense to the extent that we have the power to fix it at CMS. I'd like to do it. We've had the same kind of complaints from Vermont. But I said to you at that time, call me and let's come talk about this. You have my cell phone. You can call me anytime. I've never heard from you in 7 months. Call me up. I'd love to meet with you. I'll get Oz in the meeting, and what you're saying, particularly about at the end of life, it may be something we can do something about. I want to help, and let me know.
We'll try. Forgive my frustration. You've got 30,000 employees. They could have reached out to me. They know where I live.
Yes. Senator Cortez Masto.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on big pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed big pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo, and Darzalex, the 3 top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on big pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. What we found is that the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. It's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
That is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those, bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure that provision in the bill of the one beautiful bill, but
You're not sure of the provision, the negotiation provision, and how exempted
for
cancer drugs?
Keytruda.
Your agency is responsible for that negotiation and you don't know about it?
I know that we're negotiating in the MFN
Let me ask you this, Mr. Secretary. Let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the rate?
They are going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to Dr. Oz
that is about,
yesterday. I think it's
they're supposed to increase
16%.
about 11.6% or $21.50 more each month. And again, last time you were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. Next year, seniors and families are facing higher healthcare costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6% to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing what I'm already keeping costs down.
What are you doing to keep costs down for seniors, knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A congressional budget office has said that that's brought premiums down by 5%. As the Congressional Budget Office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
for helping
costs.
Seniors. Does it impact seniors?
Does it impact?
Come on. Let me just stop here.
I didn't
My
hear
time is
what you
running out,
said.
so I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
Okay, let's go.
We'll just proceed. And Senator Tillis has yielded his position to Senator Blackburn. So
And
she'll take it.
Thank you, Mr. Chairman, and Mr. Secretary, thank you for joining us today. I appreciate the comments you've made about the Rural Health Transformation Program. That is something many of us worked on, and we were pleased to push that out of this committee. And I know Dr. Oz is moving forward with implementing that. I appreciate your comments to Senator Warner on the area wage index. He and I have worked on fixing that, and we appreciate your attention. I am delighted to know that you're going to end the revolving door and the conflicts of interest. I have found it so unseemly that people who work with a pharmaceutical or with a big food company then go back over into CDC or NIH or FDA, and then they're signing off on regulation for their former employer and many times their future employer. So we appreciate that. Senator Langford went to you on the PBMs. And as you are aware, my PBM Act that Senator Wyden worked with me on, that made it out of this committee last cycle. And making certain that we keep these rural pharmacies open, making certain that PBMs do not profit above what is their standard service fee, and that they have to disclose all their pricing. That is going to be an imperative. So will you work with us to get that PBM legislation across the finish line and to the president's desk?
Yes, Senator, absolutely.
Thank you. Interoperability is something that you have announced, a new interoperability framework to better align data sharing principles. And this is important to digital health. And as you're aware, when we passed 21st Century Cures in 2018, the Software Act and that health IT definition is something that I worked tirelessly on to get implemented. So what I want to hear from you is, how does CMS plan to align this new framework with the existing federal framework? And how are we going to be able to move forward with one national policy on interoperability?
Well, I don't know if we, what we have right now is concrete commitments from the 60 top tech companies who we were able to convene to do data sharing, to do patient accessibility, and to do interoperability. But I can't tell you how that's going to mesh.
Then if you will have someone submit to me in writing what that pathway is, this is something that is essential if we're going to be able to benefit from that data. So having some specificity on the pathway will be helpful. I did want to talk with you. Last time you were here, I talked about the concerns on overprescribing prescription stimulant drugs for children. And there are ways that HHS can work collaboratively with state agencies on this and to actually promote more community-based intervention to combat overprescribing. And we all have seen the harmful side effects. And there's a lot of reporting out there on this and tremendous concern for grandmamas like me who see children and friends of our grandchildren who suffer with this. So I know your team is working on solutions. So you're going to have your Make Our Children Healthy Again strategy that you're going to release, but talk for a moment. We've got 30 seconds left. Talk for a moment on how you can better arm parents with information on the harmful side effects of overprescribing these stimulant drugs.
I mean, one of the problems, Senator, is that, you know, we now have 1 out of every 5 kids on these drugs and the antidepressants, even more. And we know very little about the long-term impacts because NIH and CDC have been asleep at the wheel. Right now, we are doing those studies. We're doing extensive studies so that we can warn parents and so that we can force the companies to put labels on their products. And, you know, we'll do whatever we can to show that, just to get data out to the public. That's really what our function is. And to show what the long-term impact of some of these drugs is. You know, are we actually preventing suicide or are we creating more suicide? And that's something that we don't know the answer to, which is, you know, how did these drugs become so common in our society without us even knowing the answer to those questions? That is malpractice at these agencies, and that is the malpractice that I am going to fix.
Thank you.
Thank you. Senator Warren.
Thank you, Mr. Chairman. So last November, while